Hi guys, Dr. David Fieleke coming to you from Cornerstone Dermatology Surgery Group. I wanted to talk to you a little bit about Mohs Surgery today. Mohs Surgery is something you may or may not have heard of, but it has become the standard of care for certain skin cancers, especially those that are particularly aggressive or in high-risk locations like nose, lips, eyelids, or ears. I am fellowship trained in Mohs surgery, which means I spent an entire year focusing just on skin cancer treatment, Mohs surgery, and reconstructive surgery after I did all of my dermatology training and became board certified. If you are unfortunately diagnosed with skin cancer, we'll bring you into a room like this. This is one of our surgery rooms. We have comfortable surgery chairs and state-of-the-art equipment. And basically we'll remove just what we know to be skin cancer with a very small margin around it, only 1 or 2 millimeters. In doing so, we can keep the wound as small as possible, but because we have a lab here on site, we can also ensure that we remove the skin cancer with the highest degree of certainty. Once we take that initial layer, we'll bandage the wound and we'll take you to our surgery waiting room, which I'll show you next. While you're in the surgery waiting room, we have coffee, we have snacks, we have a television so we can keep you occupied while you wait on us. And you're welcome to bring a guest and of course a book or a tablet. We do have complimentary Wi-Fi that you can utilize while you wait. But you'll be able to relax in this comfortable waiting room while we're processing the tissue over in the lab. I'll show you the lab next. It's right around the corner here. We have a highly skilled histotechnician who will take the tissue that I remove to this instrument that's called a cryostat. In the cryostat, we'll freeze the tissue and then cut it into very small layers, very thin layers, where we can put it on a microscope slide and then take it here to our stainer. At our stainer, we have different types of dyes that will specifically dye the different structures in the skin and also the skin cancer, so that I'll be able to evaluate 100% of that margin. Like I said, all the way around and all the way underneath the wound. Then once we have the microscope slide, I'll take it right over here to the microscope where I will look closely at the tissue and evaluate the margins to ensure that it has all been removed. If there is any skin cancer remaining, I'll be able to diagram out exactly where that skin cancer is, so we can go back and take another layer, but only in the area on the skin where we need to take more. Again, this will keep the wound as small as possible, but we're going to get the highest cure rate for the skin cancer because of the processing technique we're using. Once we know all the skin cancer has been removed, we'll take you back to the procedure room where we'll evaluate the wound that's remaining, and we'll be able to determine the best possible way to make sure your wound heals as quickly and as best as possible. Sometimes that's just stitching it up in a straight line. Other times we do skin flaps or skin grafts. But we will be able to discuss with you the different options and choose the option that makes most sense for you to give you the quickest healing time and also the best cosmetic results from the surgery. If you have any questions about skin cancer or about the Mohs surgery procedure, never hesitate to contact us either here on Facebook or just call our office. If you have any spots that you're concerned about that you think you might need evaluated, please just give us a ring. We'd love to see you. Bye-bye.